Hello and welcome to episode 6 of What the Health, the Everyday Person's Guide to the Patient Protection and Affordable Care Act. As you may have noticed, we have a new background today. You can call it a very large visual aid. Today's section is 1103. It's called Immediate Information to Allow Consumers to Identify Affordable Care Options. As its name implies, it talks about ways for us to identify affordable healthcare options that fit our needs. Since you're here, chances are you realize that the internet is a good place to find information. Turns out the government realized that too. Under subsection A, an internet portal, I kid you not, that's the term they use, had to be established by July 1st, 2010. This internet portal, which is way more fun to say than a website, has to contain information on a variety of insurance options for residents in any state. Private health insurance plans, Medicare, Medicaid, even the state-run high-risk insurance pools all have to be represented on this website. This may sound too good to be true. I mean, a website with health insurance options for residents in all 50 states and the U.S. territories, and it's not Wikipedia? Turns out it is real. Meet healthcare.gov, a website run by the Department of Health and Human Services that truly does not suck. For example, I masqueraded as a 59-year-old Alaskan with a pre-existing health condition, a missing left leg from a tour in Vietnam, and difficulty affording health insurance outside of the crab fishing season. 20 minutes later, I had 15 pages of health insurance options and was halfway to enrolling myself in the AICHA FED, which is the Alaskan high-risk insurance pool. At that point, I remembered that I'm a 26-year-old female living in Georgia who has health insurance under her employer, but the point is still valid. Healthcare.gov is a solid website. Well done, government. You built a fine internet portal. Now, if you've ever had to research a topic by going to a lot of different websites, you know how frustrating it can be when everything's in a different format. You don't know which tabs to click or which keywords to use to search, and you spend most of your time just trying to find what you need. Luckily, the authors of this section seem to have been there. Subsection B gave the Secretary the task of creating a uniform structure for reporting on health insurance plans. Remember a few episodes back when we talked about all the new reporting laws that health insurance companies have to follow? This is where that all comes into play. All that information on plan costs, benefits, and company expenditures has to be reported on this website. Better yet, the same format is used for all plans detailed on the site. So whatever your health insurance options come out to be, you don't have to waste time figuring out how to compare them. That's it for this week. Go check out healthcare.gov. Play around with the health insurance finder. See how uninsurable you can find yourself. As a bonus, anyone who can send me an unaltered screenshot of a combination that results in one single health insurance option wins $500 internet dollars. They're not worth anything in real life, but they are tax-free. Come back next week for section 1104, which is almost 8 pages long and ironically titled Administrative Simplification. Till then, stay healthy and we'll work on a better sign-off phrase.